Well, good morning, everyone. Welcome to our PACEBO Wednesday webinar for November. Today's topic is electronic health records, and we're pleased to introduce one of our newer partners, our friends from SchoolDoc.com. As you've seen from our communications, SchoolDoc.com's primary product is an electronic health record system and is a secure, easy-to-use web-based solution that manages health forms, medications, immunizations, and injury illness tracking for your school. As a little background, we first met the folks from SchoolDoc.com at the NDOA conference back in 2017. They were already working with some of our schools, so it seemed like a natural fit. At this time, I'd like to introduce our contacts from SchoolDoc.com, Riley Nolan, Director of Sales, and Carolyn Tiers, Director of Marketing and Strategy. They're the folks that you, our members, will deal with directly as you get to know SchoolDoc.com. So at this time, I'll turn things over to them. So Riley, welcome.
Awesome. Thanks, Ron, so much for setting this up. And this is great. Really excited to kind of show some of the PACEBO schools what's new with SchoolDoc. For what we're covering today, I do want to keep it kind of short and sweet. So I do want to show a little bit of the software just to give folks a sense of what's possible. But I'm not going to have enough time to cover all the features. So just want to put that out there. What you're seeing today is just really it's basically the highlights, and what I want to leave room for at the end is more of a question and answer session. So once I show a little bit of the software, we'll kind of bring it back, and I think Ron will be able to facilitate some question and answers from his side. And I think the participants that are logged in here, there should be a box for you to write in some questions or send them over to the PACEBO team. So please do that throughout the webinar, and then we'll come back at the end and we can go through and answer some of those. So to start off, and Ron, can you see my screen okay? Is that
yes, we're good to go. Everyone should be able to see what you have there, so you're good to go.
Perfect. And so just a quick note on the PACEBO partnership, we actually do offer discounted pricing for schools that are PACEBO members, and we do some other things where we'll do webinars like this, and then we also have content and some of the PACEBO flyers and newsletters. So I do want to kind of touch on initially just kind of why a school would use a system like SchoolDoc, and it's a tricky question because each school is different. They have different needs, but there's definitely a couple key trends that a lot of our schools come to us with specific needs, and I just kind of wanted to go through that. So schools will definitely make use of SchoolDoc if maybe you're having some frustration with the forms collection aspect. So SchoolDoc will we have a function for collecting any of your required school forms completely online. We specialize in medical information. We're an electronic health record system, and there's a lot of security and privacy that goes into collecting that type of data online. So that's sort of our wheelhouse in terms of medications, allergies, medications, immunizations, but we can really collect any sort of re-enrollment paperwork, permission slips, sports physicals, things like that, athletics forms. So if your school has had issues in the past collecting that information from families, maybe you've had the experience of school starts and you still are missing a bunch of paperwork from your families, and you have students on campus that you don't have full documentation for, then a system like SchoolDoc can definitely help with that. We'll do things like reminder emails to your families to reduce the amount of follow-up that you have to do. Another thing that might be a reason for using a system like this is that if your staff have expressed frustration with sort of the charting processes during school. So maybe treating students, giving medications, maybe that's a source of frustration where it's taking too much time. Maybe it's a little bit disorganized. We can, I'll show you some of the day-to-day features for managing student health and safety. So with that, let me jump right into the software so we can go through and show you what it looks like. And Ron, are you seeing the screen that says Christina Allen at the top?
Yes, we are. So you are good to go.
Okay, perfect. So what you're seeing now is I'm going to take you through a SchoolDoc demo account. And what I'm going to do is I'm going to start from the family perspective and just show you what it looks like to fill out forms with SchoolDoc. So this screen that you're seeing here is going to be the landing page that families would see when they're first logged into the system. We can customize this for the school. So maybe we call this a student profile instead of a health form if that's more applicable. This can be any sort of direction that you'd like to give to your families. Maybe you want to put in due dates for when the form should be in by. For most of our schools, this is usually some point in the spring or the summer going into the following school year. And then on the right-hand side, this is where we have the actual school forms. What you're seeing here today are just kind of some standard boilerplate sample questions. But this is really where that customization comes in, and we're going to completely build in your school requirements. So we'll change the names on these forms. We'll add or remove forms based on your needs. And you'll see that from the family's perspective, it really just tells them green check mark means they've completed the form, red dot means that they have some additional work to do. And this is what will trigger those reminder emails. So families can't skip a question or miss a back page. They'll get these follow-ups from the SchoolDoc. That's really going to help with form compliance. And before I dive too deep into the form, so I do want to kind of touch on how this might work alongside some of your other systems. So if you have a student information system at your school, and most schools do something like PowerSchool or Blackbot or senior systems, we would import a roster of your students into the system, and we'll send a welcome email to them to get started. So just to kind of put that out there, that's how families get into the system. Depending on which student information system you're using, there may be additional functionality, but that's a little bit too detailed for this webinar, but certainly reach out to us if you have questions about your specific student information system. I'm just going to pull up a couple of our forms here just to kind of show you an example. So allergies is a common one that we see for a lot of our schools. And I'm just going to go ahead here and fill out an allergy form for Christina. So as soon as I say yes that she has an allergy, additional questions pop up. And we'll go ahead and say that she has a peanut allergy. There's actually a drop-down menu to help the families. So we have that built into the application at various points just to help the families out. And it'll ask if they have an EpiPen that they're bringing to school. So really important questions to ask. We know that for a lot of schools, you require an emergency action plan for students that have a life-threatening allergy. So they can actually download that plan here. And then this gray box here is where they can upload a document that's been signed by a physician. And I'm just going to pull up an example. We use the FAIR action plan in our demo account here. But I just wanted to show this example because we know a lot of schools will have the same type of thing for asthma action plans, diabetes action plans, maybe seizure action plans. So we will build that in. I'm just showing an allergies one, but that's just an example of what can be included. Another really important area is medications. So it's important to collect that information on what the student is taking during school. Or so we'll go ahead and put in a medication here for Christina. Let's say that she takes Claritin. And the drop-down menu that you saw was pulling right from the FDA database. And the strength of the medication is synced up. So it's really a standardized method for collecting that information, really reduces the amount of error. And then families can actually tell you when the child takes the medication at school, and also why they take the medication. So Christina has some seasonal allergies here. We'll go ahead and say yes to that. And the nice thing for your staff is that when families are inputting their medications as part of the forms, that automatically transfers to the staff side. So when they're giving medications during school, they already have a pre-built to-do list. We call it our EMAR, our electronic medication administration record, but it's already put together. So that's a huge time saving for your staff. We can also collect information on over-the-counter medications. So just a really easy way to collect permissions on if you're stocking things like Tylenol or Benadryl at school, families can say yes or no. And the great thing is for your staff, when they're treating a student, the health log will only allow you to dispense based on these permissions. Immunizations is another really important area for schools, and we have various ways to track this, but we can have families upload a copy of a recent immunization record. We just have an example of our Michigan one here. And we also have, for the schools that need it, you can have families put in the actual dates that an immunization was received. I just want to jump down and show you sort of at the end of the process here, an example of our electronic signature. So this is a legally binding electronic signature, and a lot of schools have this at the end of the process and just have families sign a date that everything is true and up to date. And we can see that, that David signed and the date and time that he did that. We can actually take this and put it on any of these other tabs. So I know I referenced at the beginning of the webinar that we can include any sort of paperwork. But let's say that you have a liability waiver that needs to be signed. We can actually build that out as a separate form, or maybe a permission slip or a photo release form. Those can be included too. So just kind of, and I always recommend to our schools, look at your process. If there are forms that you don't have a good spot for, consider putting them into SchoolDoc, because we don't charge based on the number or complexity of forms. So it tends to be a good place to add that in. And before I jump to the staff side, I do want to just talk about how this works year to year. So for your returning students, there's a huge convenience for families in that the information can save from year to year. So they don't have to start from scratch the next year. What a lot of our schools will do is maybe you'll want them to update some pertinent information. So maybe going to the next year, you want them to update their allergies and medications and maybe re-sign electronic signatures. But for some of the basic stuff, maybe the student information, diet and activity, they don't have to start from scratch with that. So it's a nice convenience for your families. So let me switch gears and move over to the staff side of the application. And what you're seeing now, this is the landing page that your staff would see when they're first logged into SchoolDoc. You can have as many staff in the system as you would need. I would say typically, and it's really up to you in terms of who has access to the system, but typically the school nurse, athletic director, athletic trainer, social worker, any behavioral specialists. You can give access to your administrative staff if they need to see some information. But one of the great things about using an electronic health record is that you can have specific permissions set up in the system based on a role. And the reason that we do that is it's really important to protect the student health data and ensure that only certain staff members can see what they need to see. So to give you an example of that, let's say that a school has an upper school and a lower school, and you have a nurse at each location. You can set restrictions in SchoolDoc that the lower school can only see that group of students and can only give medications and make health log entries for that specific subset. To give you another example, maybe you have administrative staff that need to be able to go in and view information like emergency contacts, but they shouldn't be able to edit or change anything. We can also set up that level of permission. So completely up to you in terms of the roles that you want to set up, but that'll be how it works in the system. When I log in here, I can see at a glance here just a roster of my students, and we can see first and last name. This percentage is actually showing how complete their forms are, so it gives you a good sense of where your families are and getting things into you. And then on the right-hand side, this is our list builder. So, and this actually ties into the reporting. So what I can do here is I can put in a condition, and maybe instead of looking at my whole school, I just want to look at our grade 4. I can go ahead and select that group of students, and now I can run a report for anyone that's in grade 4. For the reports, we have a lot of kind of standard reports, and just to give you a sense of what those might be, like let's say that you need an allergy report for a specific grade of student. That's something that's in our standard reports. We have pre-built these because we know a lot of schools will use them. Let's say that you're going on a field trip and you just need a roster of students that's going on that field trip. We have a check-in report that's really great for that use. Maybe you just need a list of everyone that has a food allergy. Those are all built into the standard reports. However, we also have a custom report builder that allows you to go in and you can actually pick and choose what you want on the report. And maybe this will allow you to, I'll just give you an example from our demo account. Maybe I need a report that has dietary restriction information and allergy information. And I just need these two pieces of data because I'm going to run a report for the kitchen. That's all going to be right on that report. So you do have some flexibility there. And I do want to pull up an example here. So I just pulled up an example of our allergy report, and I'm going to pull up a PDF copy. Our reports you can run as a PDF or as a CSV file, but just to give you an sense, if you needed to print off something from SchoolDoc, the PDF reports are designed for easy printing. And then I did want to touch on our send message feature. So it's also tied to the list builder, but let's say that for everyone in all your families for grade 4, you need to send out a message and say, okay, there's been a strep throat outbreak, or there's an important announcement. We can actually send out a mass email from the system, and you can actually have templates. So I just pulled up a strep throat example, but you can build out templates to send things to families over and over. A recent feature that we added this past year is a texting feature. So this is something that a lot of our schools asked for, so we added it in. This is really great in emergency situations. So you need to communicate with your families quickly. You can send out a text message from the system. There is a cost to this of 5 cents a message, and the way it works is that you would build tokens into your account. So the next two things I'm going to cover is more geared towards the treating students. So I'm going to go into our health log and our EMAR. So I'm going to start with the health log. This is a feature that the school nurse, athletic trainers, other staff that are treating students during the day would be making any notes. So someone comes into the office, that's how it works. And I'm just going to go ahead, I'm going to make an entry for Christina, and we'll go ahead and select our student. And then we can go ahead and fill out an entry. The fields that you're seeing here, this is organized in SOAP note format. So for the nurses and medical staff on here, I'm sure that's familiar, but it's collecting the subjective information, the objective information, and indicating your assessment and plan. So the main fields here are pretty standard medical fields. However, we do have criteria on the side that you can add in. So if I want to take a student's temperature, it's now highlighted in green, and now there's a spot to add in a temperature value. One of the great things that a lot of our schools will use are templates. So you tend to see students for the same type of thing over and over again. So you can actually build templates in here. So I'm just going to pull up an example of like a vision template. So if you're doing vision exams at school, you can build out a template for that. So it's super quick to go through and treat students and take those notes. And then you can also look at your health log data kind of all together. So historically, when you're charting things on paper, that data is not really usable. It's impossible to pull out any sort of trends, to go back and kind of look at, what was going on. But now with an electronic health log, I can actually go back in and I can say, okay, show me everyone that came in this year for an allergic reaction. And it pulls up the list of 3 students that came in for that type of incident. So it makes that data usable. It's really going to help with risk management, so you can find trends and pinpoint that and try to make things safer for the next year. To that end, we also have the statistics tab. So this is going to be some of that information in graph format. So you can put in a date range here. We can look at visits per day over time, different chief complaints, which providers are making entries. So there's an audit trail in the system. If you ever had to go back and say, okay, which staff member gave this medication or things like that, there's always a record. And you can also chart locations. And you can actually put in your own custom location. So if you wanted to track, how many people were injured on the football field at this past year, you can actually pull up that report. And then to touch on medications. So if you're giving a lot of medications at school, the EMAR is really going to be helpful. This is our electronic medication administration record. And I'm logged in here near lunchtime, and it's just showing me my 5 lunchtime medications that I need to give. So your staff can simply go down the list and click to give medications. It's stamping with my initials here, but it would be customized for each of your staff members, just an example of that audit trail. And I can go ahead here and add in notes. So let's say that Eric refused his medication today, and we didn't end up giving it. We can add in custom notes, and we'll go ahead and mark that as not given. And we get alerts anytime a medication is not given. And then one last thing that I want to go back to is an individual student's profile. So I'm going to go back here, and I'm going to pull up Christina's account more from the staff perspective. So this is the student that we filled out health forms for at the beginning, but I kind of want to take this full circle and just kind of show you what the staff perspective would be of going through and reviewing the forms. So that's another area that's kind of a pain point for a lot of our schools, is that once you have the forms submitted, it's the responsibility of staff to go through and look at, understand the data that's included there. And this is how you'd go through and do that. So I've pulled up Christina's account. And now I can simply go through and see what the family's filled out. So I can see all the student information here. Any photo icon means there's an uploaded document. So I can open up this immunization file and take a look at that. And to help with that process, down here at the bottom, we have this review and notes tab. So this allows me to go through, and I can actually mark different forms as reviewed or not reviewed. So let's just say I went through and looked at her immunization file. Everything looks good. I'm going to mark it as reviewed. You'll see that it stamps it with my name and the date and time that I reviewed it. So just an example of that audit trail. one of the nice things about SchoolDoc is that you can go back and run a report and say, show me everyone that I still need to review for immunizations, and it'll just show you that to-do list. So it's a nice way to keep things in order. And then one final thing that I'd like to show you, and this is sort of a, just for some of the schools that might have a use for it, we also have an optional online registration feature. And I mention this because something like 80% of independent schools have auxiliary programs. These might be summer camps, they might be after school programs, they might be trips. And what a lot of our schools have asked for is a simple way for folks to sign up for these programs, possibly make a payment, but also fill out any required documents that go along with it. So if it's something that you could use, we can actually give you a link to put on your website where families can self-register for a program, and then they can go ahead and sign up. So I'm just going to sign up Christina here for a wilderness adventure. So this list will be customized just based on the trips or programs you're offering, but we can customize the description, the pricing, the dates. So let's just go ahead and register Christina for wilderness adventure. We can have optional add-ons if there's any t-shirts or other costs that go along with the program. They can put in coupon codes. So maybe you offer a discount to students that are attending the summer that are from the school. We have a $50 gift discount here. Totally up to you though. And then I also wanted to talk about our protection plan. So this is something that's, it's not a cost to your school, but it is a nice benefit, and it provides, for your families, it provides a tuition cancellation protection and short-term emergency medical coverage. So let's say that someone signs up for a program, they have to cancel, they can actually be refunded through this. Or let's say that someone had to go to the emergency room, this would provide first payer coverage from no deductible, so it'll pay before the family's insurance plan. I think a situation where this is really useful is especially if you have international attendees, which I know a lot of the schools do, and you have some sort of requirement that they come with some short-term US health insurance. This is going to fill that requirement, and it's right during the registration process, or we can add it as part of the forms as well. So just to touch on that. And then if you're using the registration, we can collect payments online, credit card, or electronic check. If that's something that's applicable. So, Ron, I'm gonna stop there, and maybe we can start up the question and answer session. Does that sound good?
Sure, no problem. Actually, I have a question that we didn't talk about. You talked about the text messaging feature, and you said something about tokens. Can you explain what tokens are? That's some kind of credit?
Yeah, great question. So the texting feature, you preload tokens on the account, so it's about 5 cents a message. But we can see we loaded 5,000 tokens on here. So every time that you send out a message to an individual, that'll cost 5 cents. So if you're sending out a message to 30 participants, you just want to calculate what that cost is going to be. For that reason, I don't recommend using the texting for kind of routine communication. I think the email tool is better for that, but the texting is going to be better for kind of emergency situations. And I'll give you an example. Some of our clients were affected by the California wildfires, and a lot of their off-campus trips and activities were canceled, but they had a situation where families were already on the road. They needed to send out a message really quickly, and they used the texting feature for that. So something to have in your back pocket for those kind of emergency situations.
Okay. Something else that occurs to me is if your internet connection is down or if someone is off-site, do you have any kind of mobile? Is this something that can be adapted into a phone app or something?
Yeah, that's a great question. So the entire site is mobile optimized. So that means that it'll snap to the size of the screen that's being used. So you can use it on a smartphone or tablet. And we definitely see a lot of families filling out the phones on mobile devices. And there's no separate app from like the App Store. You simply just have to use the web browser on your phone, and it works on all the major browsers: Safari, Firefox, Google Chrome, Microsoft Edge.
Okay, great. That's good. That's good to know. I do have a question from the chat. We have, as a small school without a tech manager, how difficult is the system to set up, and what is available for support from your end?
Yeah, that's a great question. So we actually give quite a bit of support. We take a guided partnership approach. So what that means is that you have a SchoolDoc account manager that's going to be building out your account. So to get started with us, you simply have to provide the forms that you'd like to build in. And some of our schools will use our standard SchoolDoc questions, and we can kind of advise you on, when to use those versus your own forms. But we will actually build out a test account for you based on your own forms, and then you have time to review it and go through it. Once the test account phase is done, we will then do training webinars with your staff. It'll be sort of similar to this, where we'll do live training webinars. We can do additional training sessions as needed, but typically what we're hearing from schools is that the software is very intuitive and easy to use. I always personally encourage people to take part in a training just so you can see like the full extent of what's possible. The other thing to mention with that is, I guess, timeline, that we need a little bit of lead time to build out an account. So at minimum, we ask for 3 to 4 weeks to create an account for you. I like to give it even more lead time if possible of 2 months. And I like to work backwards from when your re-enrollment starts. So if you start re-enrollment and you're sending out the forms in May for the next school year, then we'd like to start the process probably in February or March, just to build in a lot of time for that test account training to set you up for a great first year.
Okay, good, thanks. Another question, who do you consider your primary competitors in this space? And aside from price, what differentiates you from them? Yeah,
that's a great question. So I guess it really depends on the types of features that you're looking for. There's quite a few other software platforms out there. The two that come to mind, Magnus Health, I'm sure a lot of the schools are familiar with them. They're another electronic health record software. And there's another program called Snap, which is it's an older program. It's been around for a bit longer. SchoolDoc is a web-based platform, and that's sort of the future of software applications is web or cloud-based applications. So we have more experience than Snap working in that space, and I think it's a lot more intuitive and easy to use for families. But it really depends on the specific needs of the school. I'd say one of the reasons to use SchoolDoc over maybe one of the other platforms is ease of use. If that's something that you've gotten complaints from your families, that the current system is not easy to use, it's hard to understand, then SchoolDoc could definitely be a good option for you, because we've really taken the care to come up with something that's very simple and straightforward, yet also robust enough to accomplish what you need to do in terms of day-to-day charting. The other thing that's sort of unique about us is the online registration for auxiliary programs. That's not something that you're going to find with some of the other software platforms that are out there. But and I'm happy to address kind of more specific, like if you're using a system currently and there's something that you don't like or that you want to compare, we can definitely talk more about that on a case-by-case basis.
Okay, great, thanks. A couple other questions, I guess. You had mentioned now this column that we're looking at here. This on the left that's the students, right?
That's exactly right. So this is my roster of students.
Okay.
And
now
this
you
will
went
be customized based on your permission. So if you just have access to like a certain segment of students, that's what you're going to see.
And there's no limit to the number of staff that can be put into the system to maintain, monitor, whatever the system?
Yeah, that's exactly right. There's no limit. You can have as many staff on as you need, and there's no cost for staff access.
And depending on the permission, so you can, like as you said before, you can have your lower school nurse that can only see lower school student profiles, etc.
Yeah, that's exactly right. And actually what I can do here is I can show you a little bit of that permissioning system. So what I'm going to do is, instead of looking at my list of students, I'm going to look at our list of providers. And this is that's our term for staff members in the system. So we can see our 17 staff members. And if we click over to Power Tools and then Manage Permissions, what we can do is we can actually look at the roles for our school. These are just some common roles that a lot of our schools use, but these would be customized just based on your needs. So I'm just going to click on our school nurse role. And let's say that Olivia is a new staff member at our school. She's joining us as a school nurse. We can go ahead and grant her access as a school nurse. And you can see under the permissions here that we've already set up what that role should have access to. So a school nurse can send emails, they can view, they can send text messages, they can edit the EMAR and the health log. So you set up those permissions in advance, but then it makes it really easy to add staff to the system and know that they just have these specific permissions.
So that protects privacy concerns and such.
That's exactly right, and that's the most important, I think, thing to consider just for protecting student data is, how do you give access to your staff and ensure that they can only see certain things, and that permissioning system is how we're accomplishing it.
Okay, great. Another question: can you add staff information into the system? So you have staffers with food allergies, etc., medication needs. Can staff be included in this as well?
Yeah, that's a great question, and we can definitely do that. One of the things that I didn't mention from the family side of things, and I'm just jumping back over to the family side, is that the forms that would be seen here are going to be completely differentiated based on that their grouping. So we can actually have a separate set of staff forms, and staff will just see what's required there. And some of our schools will do things like maybe background checks, references, W-4s, whatever you need for staff. Some of that health information that you mentioned, that's what would be available to staff when they're filling out forms through SchoolDoc.
Okay, great. That's awesome. I think we're getting close to the end. If anybody has any other questions, maybe what we do is we can talk about pricing a little bit. And if anybody else has any other questions, please feel free to weigh in. And if there's anything we've missed, Riley, please feel free to mention it now.
Yeah, absolutely. The only thing I was going to mention is actually support. So we do have the training, and you have your SchoolDoc account manager, but we also have a support desk that we actually do phone and email support for your families as well as staff. So I mentioned that because that's a huge time saver for schools in terms of, let's say that a family forgot their password, or if they need help uploading a document, they can actually call us and we'll field that question. So it takes a lot off the school's plate. And we actually do extended hours and weekend hours in the summer when families tend to be getting things ready for the next school year. So they can get in touch with us, and that should take some things off of the school's plate.
Okay, good. And did you want to touch on pricing a little bit, discounts and et cetera?
Oh, absolutely. Yeah. So pricing for SchoolDoc it's just $8 per student per year. And that's for a 12-month period. So if you're in a school that has auxiliary programs like a camp or after school, you're only charged for that student once per year, regardless of how many programs they're taking part in. So if your students are coming from, for the summer, are coming from the school, there's typically not too much of an additional cost. So $8 per student per year. If you sign a multiple year contract, we can offer a reduced rate. So $7 per student for a 2-year contract, $6 per student for a 3-year commitment. And what we actually do for Pay as Both schools is we offer a 25% discount for the first year of service. So that would be the first 12 months, 25% off.
Okay, great. I think we've kind of covered. Is there anything else you feel that you'd like to touch on before we sign off? I think we're just about at our time allotment. So I want to thank you for your time and for presenting some good information to our folks here. So anything you'd like to mention? This
was great, and I really appreciate Pay as Both setting this up. I would say to any schools that are interested, get in touch with us. We're happy to have the conversation about your forms and situation. We love talking about your current process and see if we might be a good fit. So feel free to reach out to us, and I'll actually pull up my contact information here. And So feel free to get in touch with myself or Caroline, and any questions. We have additional webinars that go into a little bit more detail. So today was kind of a broad overview, but certainly feel free to reach out to us. But yeah, thanks so much for taking the time today.
Okay, great, thank you. Well, one more quick question. 25% off would be 25% off the $8 for the first year? Yeah,
exactly. So that would bring the cost down to $6 per student for the first year with no contract.
Okay, wonderful, thank you. Okay, yes, as you can see, there's the contact information for Riley and Caroline. So thanks again for joining us today, and we will be posting this to our website fairly soon, so we'll have that up if you have any additional questions or if you want to review what we talked about today. And again, if you have additional questions, please feel free to reach out to Riley or Caroline, and they'll be happy to help you. And if you have any other questions, you can also contact us as well. So thanks for joining us today, and we really appreciate it. And we'll see you again real soon. And Riley will be talking very soon.
Awesome. Thanks so much. Have a great day, everyone.
Good day, everyone, and happy holidays.